Hello and welcome to another conversation. We all want to look beautiful or handsome, and for that we go to extreme ends to change our bodies. But behind that there is also a positive side, and the side which we ignore to look into. Why plastic surgeries, cosmetic surgery is so important. So today we're going to talk about and explore the world of cosmetic surgery and the benefits it brings in, as well as the dangers involved. We have a cosmetic surgeon. Niroshan Sivathasan here. Welcome to the show.
Thank you very much for having me, Raj.
So, what actually inspired you to go into cosmetic surgery? First of all, before we go in, because I'm not sure what's the right term, is it plastic surgery or is it cosmetic surgeries? What is the difference? Just explain a bit of it.
So, plastic surgery traditionally has encompassed both reconstructive or corrective surgery, and it's also encompassed cosmetic surgery, in other words, to beautify someone. Over the last few years, the cosmetic surgical side of things is taking its own pathway. Traditionally, it was a subset of plastic surgery, but essentially cosmetic surgery focuses on improving one's appearance, which also has a significant effect on the psychology of the individual. So from a very simple point of view, there is no disease per se that cosmetic surgery is necessarily trying to correct. And that is arguably the key distinction. So one is reconstructive, one is aesthetic or cosmetic.
So in generic, we can say as plastic surgery, it has different, kind of use.
Two key subsets,
that's
absolutely.
Right. So especially the constructive, reconstructive side of things,
Yes.
which is essential. Otherwise, their daily life will be kind of affected.
So that would typically be for somebody who's, for example, had significant cancers or been involved in trauma, and we have to move one part of the body to another part, or reconstruct with perhaps implants or something to give them as normal an appearance as well as function. So essentially plastic surgery deals with improving the form and the function of an individual.
So what actually made you to go into the field? Because normally it's the tradition is to go into medicine, yes, but this is a very, very niche area. So what kind of inspirations you had, like what pushed you, or what kind of the factor behind that?
Okay. Well, I followed the normal pathway into medical school, so I had 5 offers, very lucky at the time, got everything, got into medical school, University College London. I then finished my surgical training with the Royal College of Surgeons of England, and during that period it's fairly broad. One gets a lot of exposure to general surgery or bowel surgery, for example, orthopedic surgery and so on. But one thing that really appealed to me about plastic surgery was its significant impact on one's psychology and function from that point of view, but moreover it is the pursuit of excellence. In many ways we are what people see us to be, and that works in a positive cycle in the way that we project ourselves. So plastic surgery, I found, in addition to the functional side of things, I just love the excellence of...
So at which point you decided that you want to go in? Because I think you also did gynecology, right?
No, I was, after qualifying, I wanted a number of qualifications, so I was quite lucky. I did all sorts of exams and I passed them, so I have a lot of qualifications, but pretty much from the terminal or end part of medical school I knew that I wanted to be a surgeon. I like the fact that with surgery you can get a tangible difference straight away, as opposed to say general practice or medicine, where you are giving medication to someone and it can sometimes take a little while to see a difference. In surgery you get a noticeable difference then and there, so that very much appealed to me, and I also like the decision making that's involved. But after qualifying, during the surgical training as well, I realised that plastic surgery, and in particular cosmetic surgery, was the thing that I enjoyed the most.
So what makes it unique in terms of, because you said that there are 2 sides, right? And is there any reason that you made your choice to go into cosmetics?
I suppose my experiences meant that I've dealt with very sick patients, both from a burns point of view, which is something I absolutely love, maxillofacial surgery, etc., so a lot of cancers and so on. What I like about cosmetic surgery is that the patients are, by and large, very well. A significant number do have psychological issues, but it's down to the surgeon to make sure that we select patients carefully. But essentially, we're dealing with well patients, and we're dealing. And I just enjoy the process involved, where it's about patient selection, correct guidance, and so on and so forth. So I think that was one of the key things, dealing with a younger population who would very much benefit from, I suppose, an artistic flair, understanding the concepts of beauty, proportions, so on and so forth, to add a somewhat artistic touch to the medical process.
Because when you say kind of the beauty or kind of handsomeness, like whatever it's called, but it's also relative to what is being perceived as.
Absolutely.
So this is where always difficult to discuss about what is the perfect body you're looking for, because it's relative. To one person it would be
that is a
and this,
fantastic
but
point,
then there are some kind of norms which the showbiz industry have created. So when you select patients, is there any specificities in terms of the patients? I mean, you said the psychological side of things,
Yes.
which is immensely
Extremely important.
So what kind of criteria you kind of apply in terms of?
If you look at beauty as a whole, one should consider the patient with regard to his or her ethnicity. Different races have, for example, different skeletal structures, the way the face, for example, appears, and so on. In addition, of course, there's going to be a societal trend as well. What we consider normal, say, in the West, is going to be fairly different from what
And
people...
time as well, isn't it?
And time.
Because 60s and 70s not the same as in 2000.
Absolutely. So if you look at the shift, initially, for example, with women, it was a fuller figure, then it became very thin, and now the pendulum is swinging back. But despite individual variations, there are certain proportions that are consistent across all ethnicities, across all cultures. And there's a magical ratio which a lot of mathematicians know as the phi number, 1 to 1.618. And those proportions are very much consistent for people all around the world. So I suppose when I'm considering somebody for cosmetic surgery, in addition to making sure that they've correctly thought about what they're about to do, that they understand the implications of what they're going to do, and that they have realistic outcomes. And it's extraordinarily important to make sure that a patient has a very honest take on where they are today and where they wish to be. Then I would guide the patient and ask them, for example, what do they do for a living, how do they wish to be perceived, etc., etc.
Because that's also a change, isn't it? Overnight, as you said, the surgeries can transform somebody overnight.
Yes.
But how they're going to be perceived within the society next day?
Yes.
Because it can have negative consequences as well. In fact, it can actually give the opposite of the moral.
It can absolutely give the opposite, and we've got so many examples in the media where people have, for example, had awful surgery to their lips, and it looks like a monkey's lips, or their faces look very stretched, almost like a clown's face. Women having extremely large breast implants, and if the surgeon has not adequately counselled the patient and guided the patient through the predicted journey, then the outcome can be very disappointing for all stakeholders: the surgeon, the patient, patient's family, etc. So it's one of those things that I find that I really enjoy, in terms of taking the patient from point A to point B, but giving them a very honest appraisal. I call a spade, and I think that's that's a very important facet of being a safe doctor, but particularly a cosmetic surgeon.
As an awful lot of work and responsibility on your shoulder.
Because
ideally, right. What you're doing is you're operating on a very healthy patient.
Yes.
And it's not like you're treating a disease or something, and everything rests on you.
And the leeway for accepting suboptimal outcomes is much smaller. Patients are less forgiving, and understandably so. But again, it's down to the doctor to choose carefully. But at a very simple level, if a patient has, for example, a cancer, sometimes a surgery is their only solution.
Yep.
If radiation and chemotherapy, etc., are not suitable. Whereas with this kind of surgery, it's an elective procedure usually, and therefore tolerances are much, much tighter. So there is a lot of potential heartache and headache involved if things don't go as well as planned.
So all of these qualifications in London, and then yet you decided to go to Australia.
Yes.
So you think or you consider that a lot of Australia needs cosmetic surgery, or?
Well, certainly, Australia has a lot of beach culture and so on. They love to look good. Why did I move to Australia? It's a good question. I suppose one of the things that really appealed to me was the lifestyle there. It is somewhat more laid back, but moreover the sunshine. I've just found that my journey in Australia has been extremely a very positive one. I've enjoyed working in that structure.
So predominantly it's the Australians or around in Australia, or do you travel around?
Well, I have registrations in a number of areas.
Right.
So I do, and I do teach around the world as well, Singapore and so on. But in terms of operating, the bulk of my work is in Australia, but I do some other work around the world as well. But yeah, it's certainly, there are a lot of British people moving over to Australia. Just from a lifestyle point of view, it's less packed, it's cleaner and so on. So it's certainly something that I've enjoyed.
So over the years, kind of in your experience, what is the most operated body part like people come for?
From a cosmetic point of view?
Cosmetic point of view.
Depends on the gender. Women, they obviously, a lot of them want breast surgery, and they want liposuction as well. Men are increasingly taking up cosmetic surgery. Traditionally, about 10% was the male market. People are finding around the world that it's increasing to about 30%. In some countries like Korea, it's fairly common for parents to give their children cosmetic surgery upon graduating from high school.
So it's kind of a gift.
It's almost a gift in certain parts of the world. There are, of course, pros and cons, and a lot of consideration that has to go into that, particularly when dealing with a younger person who may not have fully developed anyway.
So what is the youngest age they normally come in? Is there any legal regulations in terms of that?
So in medicine there is something called Gillick competence, which was the old term. Essentially it refers to whether a patient is able to, whether a patient has a maturity and the ability to weigh up the pros and the cons of their decision. Cosmetic surgery is somewhat different because it's an elective procedure or set of procedures, and therefore we're fairly stringent in saying 18 years old. But again, as we age, we have greater experience and greater insight into our decisions. So dealing with a younger patient always requires greater scrutiny. But 18 would absolutely be the cutoff as far as I'm concerned.
Oh, 18?
Yes.
So,
but to be honest, even young girls, their breasts haven't fully developed till, say, they're 21. So there is an advantage to waiting a bit before jumping in. Equally, for example, if somebody has got ears that stick out a lot, or a nose that's very large or deformed in some way and they're getting teased a lot, you can operate at an earlier point.
that's more kind of corrective.
That is more corrective, absolutely. Although we're at a point where there's a blurring of the lines, corrective versus cosmetic, really, is that wrong? Should we be tolerant of differences in people, etc., etc.? But yes, at a very simple level. So something like that, you can proceed at an earlier stage.
So the patients after operation, right? How have you kept in touch with them for a long time, or is it just is it a process? And how much of an impact they have actually seen in I know it's very difficult to quantify, but
yes.
It's important for you, isn't it? Because
it's
also like feeling satisfaction that you're doing something right.
Yes, absolutely. As surgeons, we should be very critical of our work, and we should always be auditing our outcomes. So I am in touch with a lot of my patients, and what I've found is perhaps they may come for one thing, a couple of years later they want something else, whether it's Botox fillers, etc. So there is a longer term relationship that's built up. By and large, I've got to say it's the change that a patient has to their confidence and their lifestyle, it's really very significant. Again, we're not talking about a lady who's putting ridiculously large implants, but perhaps a girl who is very flat-chested, who may want some shapeliness, etc., they find that their confidence really does improve with that kind of thing. Equally, what we're seeing nowadays is men who are getting hair transplants. It's a trend that's increasing all around the world. Certain cultures, such as the Mediterranean, Arabic, South Asian, Oriental Asian cultures, place greater emphasis on a full head of hair. So again, the young guys who've lost hair prematurely feel that their relationship prospects, etc., are adversely impacted. And once they get a full head of hair back, they just perform and integrate very differently with their peers and society as a whole.
Yeah, I understand the positive side of things in terms of psychological effect and how they feel and feel, and especially it'll enhance the performance. But there's often about criticism about the side effects, because nothing comes without side effects.
Correct. Yes.
So, what kind of side effects are there? Like, how safe it is. Like,
Yes.
as a surgeon, because when you go through the system, you will know the pros and cons and so on. So, what would be your kind of advice? Somebody who wanted to make a decision, because they have to come in with full understanding before even just walking into a hospital.
Yes.
So because in media there's quite a lot of emphasis on this, both sides.
Yes,
the positive
absolutely.
side and the negative side.
Yep.
And the negative side, sometimes there are some programs which actually highlights the extreme. I would say the extreme cases in a way. So what is your take on it?
What would I say? Well, first of all, a patient has to decide why, or think about why they want a certain procedure. Afterwards, going to a physician or a surgeon who's appropriately trained and qualified to undertake the procedure is very important. It's not purely about the pound or dollar value. It's about the expertise that comes from appropriate training. So part of that also means, for example, there's a lot of cosmetic tourism that takes place. Traveling to get the cheapest deal is not always the best thing. That doesn't mean that going abroad is necessarily wrong either. But for example, if there's a complication, the ability to deal with it may not be there. So really, what should a patient consider before cosmetic surgery? Guidance, speak to your doctor, make sure that you feel comfortable with the doctor, that they've guided you appropriately, and you feel secure in their hands. And it's very important to have a realistic appreciation of potential things that can go wrong. And again, that's down to the relationship or the rapport that's built up between the patient and the doctor involved. Speak to people, perhaps go online. There are a lot of websites nowadays, but equally one must remember that anyone can write anything online, and therefore certain things have to be considered in light of the fact that it can be any Tom, Dick or Harry who scribbled it down. However, it can open your eyes to a different perspective. Again, take concerns, discuss it with the doctor. Once you're sure that you're comfortable, questions have been answered, it's an appropriate premises, then of course you can proceed. But I always try to encourage patients to bring, especially for more invasive or larger procedures, to bring someone close to them, whether it's their mother, father, husband, wife, whomever.
To get somebody involved in the decision-making process.
Absolutely, yes. Because one of the key things is a lot of people are very excited when they come for a consultation, and they don't always remember everything that's discussed. And taking somebody along with you can act as a memory jerk, or a buffer in some ways.
Sometimes the dangerous, I wouldn't say dangerous, as a difficult decision to make, isn't it? Because I remember in situations where on life-saving times that the patient's unconscious, that if you're the next person, you had to sign on a document. They bring out it's like a newspaper. I was scared in one time before I signed. It just says everything, disclaimer after disclaimer, which is there's no other choice. The doctor said you have to sign. That's the only way we're going to start proceeding with the operation.
Yes.
This is something like that you do, or what about the in terms of the liability stands? Because I know sometimes life-saving, critical things that no choice, we had to sign.
Yes.
But in terms of cosmetics, what about the liabilities?
I would highlight one thing there. Ultimately, a patient's next of kin cannot sign for the patient.
It's on the cosmetics.
No, but for everything in medicine. Where there's something critical and life-saving, the doctor has to act in the best interest of the patients within the legal framework. So the reason we involve families to make sure that everyone's on the same page and everyone understands. But ultimately, the decision or the contract is between the patient and the doctor overseeing the patient's care. Cosmetic surgery, along with all other branches of medical practice, we do mention every potential outcome, every potential complication. And there are a number of reasons for that. Of course, there's a medico-legal side of things. And of course, as there's more legal, more lawsuits and so on taking place, the medical profession is also taking a slightly more defensive stance. But also, it's very important for patients to appreciate the potential things that can go wrong, no matter how small. So one key concept that we try to instill and discuss with our patients is that critical outcomes versus the rarity of the outcomes. So yeah, that's why a lot of these consent forms are very almost scary and very encompassing.
So yeah, that's sort of the side of things that you got to look into and look at. So before we moving in, I just want to go into a little bit of political side, which is in the UK. You practice in the UK?
I do, yes.
So do you think, I mean, I know sometimes you don't want to comment on this. Do you think the political correctness has gone too far within NHS where they cannot survive in terms of, because we really look at it, I read a paper the other day. It said that about 1/3 of the funds in NHS goes to non-critical or it's kind of cosmetics as well as stop smoking and so on. So
Yeah.
what is your take in terms, because they are struggling to provide life-saving treatments? Because, well, as a doctor who went through the education system in the UK, not as an Aussie,
yes,
but yes. So do you want to comment on that?
I think you've touched on a number of points, but essentially, I think political correctness has gone a bit too far across all aspects of society and internationally.
Specifically about NHS.
Yeah. One of the frustrating things potentially in the NHS, of course, funds are limited. It's not a bottomless pit of money. We've got an aging population. Difficult decisions have to be made. One has to perhaps prioritize between absolutely critical versus key things versus elective things, and so on. And of course, there are numerous stakeholders and multiple opinions. And I suppose one of the difficulties in any public service, and it's a very hard thing even at the federal or government level, is trying to make everyone happy. Difficult decisions have to be made, and in order to have a productive and good outcome, people have to be able to put their cards on the table and say black is black, white is white. And across society in general, actually, if people are trying to be politically correct and too sensitive, things are perhaps pushed under the carpet and deferred to a later point, when there's more tension, when there's a greater problem downstream. A stitch in time saves 9 in many ways. So absolutely, I think many doctors would say that money is wasted in many aspects of the British Health Service, National Health Service, which perhaps could be better used and better diverted. Certainly under the former Labour government, there was a massive expansion of managers and managerial positions, many of which my peers and I certainly feel are somewhat redundant. They do have a very difficult job of trying to balance all sorts of things, targets, funds.
So a lot of key performance indicators which went wrong.
Absolutely,
isn't it?
Yep. So KPIs, it's a good thing by and large, but equally it has to be taken in context. And I think that's somewhat been lost. So working in the NHS, it is a very bureaucratic system, and a lot of doctors complain, a lot of consultants I know, that their hands are very much tied and they can't perhaps always act in the best interest of the patient or exercise a healthy dose of common sense. So
I mean, this is one of the perfect systems around the world, where we have system in the sense like, life-saving,
yes,
free for all and so on, but then there is also comes with the criticism. So the whole idea of these kind of criticisms to improve it, how
yes,
do we do it? So you see that in your personal view, like
yes,
going back to 80s and 70s, that the doctors and surgeons take control of things rather than managers would be better.
Absolutely. The British system, for every pound spent, the return on that sum of money is extremely high. It's one of the most efficient, if not the most efficient system, and certainly one of the most equitable in the world, where one is not disadvantaged by how much money they have or what political links they have, etc. However, in the grand scheme of things, with an expanding population number and certain segments within that population structure or the demographics. One has to make difficult decisions. I think doctors are very much well placed to make that decision. If we look at the American model, and I'm not going to discuss the financial implications, doctors do take more of a managerial role, and that's something that, from my understanding, is dealing with a lot of colleagues from the US, that's something that's allowed very positive outcomes. So I suppose here perhaps they should create more of a medical managerial stream and remunerate those doctors who take those things on their shoulders appropriately. So I would, absolutely say that.
That's thank you for that. But let's move from one part of the world to another part of the world, because the corporate social responsibility side of things, because you do a lot of charitable work and moving to different parts of the world. So naturally, where you're from, your roots and so on, you wanted to go back home, and then you have actually went to Vavuniya and actually helped children there to do some cosmetic surgeries.
That was more reconstructive surgery.
So kind of more plastic surgery.
Yes.
Do you want to talk about that kind of, what's the beneficials of that, and what kind of work that you have carried on?
So I'm Tamil. My roots, my parents are from Chavacheri in Jaffna. I can speak Tamil fluently, and I've always felt it's very important for me to be able to go and do something, back in the motherland, as it were, to help my people. And certainly the infrastructure for burns in Sri Lanka is somewhat deficient, particularly in the north and the east. So, I found it a very rewarding endeavour to be able to go there, to be able to speak Tamil, and to be able to affect outcomes and services, and at the same time engage locally with the hospitals there and with the staff there, so that we leave something, with
kind of a sharing knowledge, and then they can actually
even
continue.
After we've gone, absolutely.
Yeah.
So I went with a plastic surgeon from here, a good friend of mine, and we undertook some reconstructive procedures there. Patients who've, for example, been in fires, who've had shrapnel injuries, trauma, etc., just to make them a bit more functional. Which is a very important thing. What people forget to realise is that in the West we're very much blessed, and when you go to the developing part of the world, be it Africa, South America, Asia, whatever, people really make do with such little, yet are smiling and try their very best. So, it was a very rewarding thing to be able to see people who have their lives changed by being able to use their limbs more, who've had very disfiguring injuries, and therefore they've become socially recluse, to be able to therefore correct that, improve them, change their lives. So that was a really.
So you're looking forward to do more visits like that? I
think if you're in a position to be able to do something a bit, I suppose, charitable or philanthropic, it is a nice and rewarding thing to do.
Yeah, coming back from your experience, in back home, where you actually born and giving something, and the reactions is quite rewarding and satisfying. And in terms of professions, because we all have different school of thoughts about how parents should be guiding their children. There is no such the correct way. There are up and downs, and the only time you will know is on the output, on the outcome.
Yeah.
So it will be 20 years later, maybe.
Yeah.
So what is your take, and what will be your message to the children as well as parents? It should be looked at as a holistic thing, not just parents, just children and parents, and society as well. Because I think within certain societies in Asia, South Asia, society plays a vital role in shape. Yeah,
absolutely.
So what is your take?
Well, I think I don't have children yet, but I have interviewed many people for medical school, and I do provide, I suppose, act as a mentor as well. One thing I would say, it's very important for parents to have an insight into their children, know their strengths and weaknesses, and not every child has to be cut and shaped in the same way. Having said that, and I totally agree with you, different cultures, especially South Asian cultures, Oriental cultures, etc., there is a big focus on education and guidance. And what I've seen from my experience and a lot of observation is that when you're young, you don't always have the insight, and certainly there is a complete lack of experience to make an informed decision. So I do agree with parents providing a structure, providing guidance, providing support. But the qualification for that is that the parents have to understand what their kids are strong at and what the kids naturally enjoy. For example, some kids may be better at mathematics, other kids may be better at sports. Certainly with an education and certainly with a degree, and as ubiquitous as they are, and of course there are differences in the qualities of degrees depending on the institution, it gives a person a chance to have something to fall back onto. In life, nothing always goes as we wish or as we plan and hope for, and having a safety net is a very important thing. So, you know, if a child wishes to perhaps open their wings at a later point after their degree, I think that's absolutely fine. But equally, I think, you know, one has to get the right balance between appreciating what the child wants, what the child naturally is interested in doing, and of course, if we have a passion for something, we are going to work harder, we're going to do much better in it. But it's a very, very tricky situation with parents, and that's in addition to having to juggle the pressures of a modern day society, children's expectations, bad influences, and so many other things. But certainly, you know, having something to fall back on, it's a safety net that one may not fully value until much later on in their lives. Okay.
So there is a balance.
Yes.
There is a balance. So, you know, it's not always the paper qualification. It's
Absolutely, yes.
the social side of things, these life skills.
A person's success in life is not necessarily the number of A's they have or their IQ. As you've very correctly mentioned, the social or soft skills, either EQ or emotional quotient, is so important in life. And that, in my opinion, determines how well someone can interact with people, and ultimately that's what makes or breaks someone, as opposed to being so intelligent and isolated. And if you look at some of the movers and shakers of the world, many of them are college dropouts. Now, I suppose what I'm trying to drill down is, it's not just the paper qualifications or the university that you've been to. There are other facets. And as a parent, what one should really strive to do is to know their kids' strengths and weaknesses. Of course, the counter-argument to that is having a degree that the child can fall back onto. Certain degrees confer, I suppose, greater kudos. Certain degrees have greater transferable skills, law, medicine, etc., which means that you can take that, you can work in a bank.
In a nutshell, it's basically, it's kind of relative in terms of parents and children, as well as parents have to actually look into it, and you know, so that's why it's important for them to open their horizon to see what's out there, because sometimes the difficulty for certain societies is that they are still living in the past, and their mindset in decision making is from the past and where they come from, and the backgrounds and so on. That's the kind of thing that limitates the second and third generation, you know, kids growing up in a different terrain. So that's something.
I would still contend that there are numerous merits to that chain of thought. It's not the be all and end all, but it does have certain advantages. But ultimately, you know, in the West, things are available to people. They have a lot of potential. Education is free, or certainly affordable, and I think it would be a real shame for someone, especially when they're young, when they've got the time and the ability to learn and to push themselves,
and the opportunity and the condition,
absolutely, to not really capitalize on that. So I think, you know, in a nutshell, having seen different parts of the world, and I've traveled extensively, we have a lot to be thankful for living in the West.
So thank you very much sharing your experience.
Thank you very much for having me, Raj.
It was an enlightening conversation with Niroshan. Very sensitive topics, so we went to explore a lot into plastic surgeries and cosmetic surgeries and so on, as well as careers, professions, and his pursuit to help you know, people back home, and his social responsibility. And you know, it's enlightening for me as well as the audience. Thank you very much for watching another conversation. Goodbye.